page K1. The respiratory system. What are the functions of the respiratory system? Well, obviously, in goes the good air, out goes the bad air. And the reason why you need the good air, you need the oxygen. And what's the bad air? Carbon dioxide. And of course, why you need the oxygen and where carbon dioxide came from are both related to the same thing, cellular respiration. Right? You use oxygen for cellular respiration to make ATP, and carbon dioxide is a waste product generated in cellular respiration as you make ATP. Now, the process of taking in the good air and exhaling the bad air is known as pulmonary ventilation, or external respiration. So pulmonary ventilation is the name we give. I mean, what does pulmonary mean? Lung. So ventilation means, you know, in goes the good air, out goes the bad air. Now, a second function of our respiratory system is vocalization. And that's because your vocal cords in your larynx are part of your respiratory system. And the third function of the respiratory system is olfaction. And that's the sense of smell. All right, now we're going to divide the respiratory system into different regions, just as we did with the digestive system. Remember, with the alimentary canal, we talked about how food moves through from the oral cavity, oropharynx, laryngopharynx, down the esophagus to the stomach, to the duodenum, jejunum, ileum, cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. We've talked about the regions of the urinary system, the kidneys, the ureter, urinary bladder, urethral canal. We've talked about the parts of the nephron, and we're going to talk about the parts of the respiratory system, the nasal cavities, the pharynx. What's the pharynx? Throat. The larynx, that's the voice box. The trachea, that's the windpipe, and the lungs. Now, when I tell you that, of course, the trachea is the windpipe or the larynx is the voice box, those are the common names. I'm not asking you for the common names. We want the technical names. But let's start with the nasal cavities. So first of all, we remind you that in terms of the nose, there are the anterior nares, or nostrils, right at the front. We've also learned that there are the posterior nares, or choanae, at the back of the nasal cavities. The front of your nose is made up of cartilage, right? These are called nasal cartilages. Right? That's why you can move your nose. Your nose is not bone in the front, it's cartilage. The only part that's bone is right here, the nasal bones, right at the top. On the next page, K2. On K2, rhinitis. Well, rhino means nose. So rhinitis is an infection in the nose. In other words, it's actually the clinical word for cold. A cold is called rhinitis. What are the olfactory receptors? There are these olfactory nerves, and they pass up through the cribriform plate of the ethmoid bone. You'd say, well, say that again. It's written right here. Cribriform plate of the ethmoid bone. And they go right through the cribriform plate of the ethmoid bone to your brain. Lower down on the page, the nasolacrimal aperture. The tears are carried from the medial corner of your eye through this nasolacrimal canal that allows the tears to come out your nose. And this opening, the opening is called the nasolacrimal aperture. Here it says orifice of nasolacrimal duct, in other words, the nasolacrimal aperture. An aperture is an opening. And we've explained that's why when you're tearing, when you're crying, your nose starts to run. On page K3, the nasal septum. What does the word septum mean? Wall. So the wall between your nasal cavities is called the nasal septum. The conchae. What the heck are the conchae? Remember the conchae? Yeah. Those are the those turbinates You have a nice picture of that is if you look, we'll make a note to see page K10. And, all right, see K10. There are many pictures we've seen before, but on K10, this is page K10. Those are the superior, middle, and inferior nasoconchae, those ridges. The word conchae actually means shelf, but these are like shelves or ridges. Okay, back where we were on K3, the paranasal air sinuses. Ever talked about those before? Yeah, originally we talked about the paranasal sinuses on pages E3 and E4. So remember this picture? The paranasal sinuses. The purpose of the sinus cavities is so that when you inhale air through your nose, the air enters into these sinus cavities that are lined by a ciliated mucous membrane that warms and humidifies the air. And we wrote that on E3. On E3 it said that. So on page K3 where we were, if we look in the bottom picture, you can see the arrows indicating how air in the nasal cavity can flow into the frontal sinus, and it can flow into the sphenoid sinus, right? So these are lined by a ciliated mucous membrane. If these sinus cavities, this is the sphenoidal sinus and the frontal paranasal sinus, if they become infected, that's called sinusitis, or a sinus infection. The choanae, or posterior nares, those are the openings at the back of your nasal cavities where the air flows into your nasopharynx. We talked about this previously on I think it was J14. On J14, we talked about right here the right and left posterior nares, or choanae, allows the air to go from your nasal cavities into the nasopharynx. So that was back on J14. Okay, in this picture on K3, what else do we see? We see that on the back wall of the nasopharynx, there is a pharyngeal tonsil. If the pharyngeal tonsil becomes enlarged, that's called adenoids. That's an enlarged pharyngeal tonsil. And we also see the opening into the auditory tubes, or eustachian canals. Now, we've talked about the auditory tubes and or eustachian canals several times. Let's look on page K4. On K4, so the pharynx. The pharynx, we know, is divided into an upper, middle, and lower part. The nasopharynx, the oropharynx, and the laryngopharynx. Again, we originally talked about this on J14. The eustachian canals are auditory tubes. We originally talked about them on pages E4 and E5, and more recently on J14. What's the clinical name for an earache? Otitis media. The pharyngeal tonsil, if it's enlarged, it's called adenoids. If you have a sore throat, that's called pharyngitis. The lower part of the throat is, or pharynx, is called the laryngopharynx. Let's look on K4. On this picture on K4, this is exactly the same identical picture, just smaller, that appeared on J15. We talked about the nasopharynx, oropharynx, and laryngopharynx. So yeah, the part that you're asking, the part that the digestive and respiratory systems share are the oropharynx and laryngopharynx. Okay. At the laryngopharynx is where they separate, where the food goes down the esophagus, but the air goes down through the larynx and the trachea. On K5, we've seen this picture before. You might say, I don't even know what the hell this is. This is that view of the back of somebody's neck where they made an incision and they spread open their neck on the back side to see the throat from the back. You had a picture just like this, just larger, on page J16. On J16. This is the passageway that air goes. Air goes from the throat, or laryngopharynx, through this opening called the laryngeal aperture down into the larynx. So the opening through which air enters the larynx is called the laryngeal aperture. What does the word aperture mean? Good, excellent. Opening. That's what an aperture is, an opening. An opening to the larynx. This is page K6. So the larynx. Where is the larynx? The larynx is this area that's sticking out right here. It's hard because it's actually, the outer part is made up of cartilage. And we're going to talk about that. Inside the larynx, behind the hard part, are your vocal cords. So that's why the larynx is also known as your voice box. It is lined by non-keratinizing stratified squamous epithelium, just like the inside of your mouth, your oral cavity, just like the oropharynx and laryngopharynx, so is the larynx. Now, the opening from your throat into the larynx is called the laryngeal aperture. Here's the word, laryngeal aperture. Aperture means opening. And so this, right here, this picture, this is the laryngeal aperture, the opening that air flows from your throat. The throat is right here, and it flows right in here. Now, as we look down into the larynx, this is the larynx right here. These are the vocal cords. The vocal cords are right here, and the slit, or space between the vocal cords, is called the glottis slit. Yes, we've covered all this before in section J. And the vocal cords are inside this chamber of the larynx. This chamber is called the ventricle of the larynx. Here's the word ventricle. Here it is right here, the word. You might say, but ventricle, isn't that's like the heart. The word ventricle just means a chamber. And in fact, not only are there ventricles in your heart, not only is this called the ventricle of the larynx, but there are fluid-filled chambers or ventricles in your brain that contain cerebrospinal fluid. So we use these words in many different places in the body. We've seen that over and over. Apex means the tip. So there's the apex of the heart and the apex of your tongue and the apex of a tooth. The vocal cords we've mentioned, the glottis slit, and I mentioned that the larynx is made up of cartilage. There are actually 3 cartilages that are large cartilages that are associated with the larynx. There is the epiglottis, the thyroid cartilage, and on page K7, below the picture, there is the cricoid cartilage. And you've got a picture that shows this very nicely right here. You'll notice that here, labeled on the left, you can see this is the epiglottis. But more relevant, the 2 major cartilages that form the front of the larynx are this large thyroid cartilage and this smaller cricoid cartilage. Now, we asked you to see that on the cat. Incidentally, if I put a numbered pin here, then you write thyroid cartilage of the larynx. If I put a numbered pin right here, you write cricoid cartilage of the larynx. Now, right below the cricoid cartilage is the trachea. And the trachea, of course, if you feel your trachea or windpipe, it also has rings of cartilage. And the purpose of all this cartilage is to prevent it from collapsing so that the airways don't collapse. Now, as far as the thyroid cartilage, why it's called the thyroid cartilage is because your thyroid glands are located right here on the sides of the thyroid cartilage. There's a notch in the top of the thyroid cartilage called the superior thyroid notch. You might even be able to feel that. It starts to feel kind of weird when you start to touch around there. But there is a notch. And it sticks out in the front right here when you feel it, especially in guys, because guys have a larger larynx than women. Thus the voice is deeper. And that's called the laryngeal prominence, or, quote, Adam's apple. Laryngeal prominence. This is the hyoid bone right here, as it shows. Now, as you know, I don't test with models, but this model is out, and I would encourage you to take a look at the model just to help you visualize the larynx. You can see on the model, this is the thyroid cartilage. Here's that superior thyroid notch. This is the laryngeal prominence. The cricoid cartilage is right here. These are the cartilaginous rings of the trachea. This is the hyoid bone right here. And this is the epiglottis. And if you look on the inside, and I know it's hard for you to see, so you take a look at this on your own, you can actually see the vocal cords, and the slit or opening between the vocal cords is called the glottis slit. And the epiglottis can close right over the glottis slit to prevent food and drink from going down the wrong passageway. So I would encourage you to take a look at the model. It takes like 2 minutes to look at it, and that'll help you understand the larynx. Now, in addition to these 3 large cartilages that form that are associated with the larynx, I wrote down below that there are 3 pairs of small cartilages called the arytenoids, the corniculates, and the cuneiforms. Does anybody like those words? Nobody likes them? Okay, then I won't test you on them. All right? Wow, you'd say, but Professor Fink, I don't like a lot of the words in this thing. All right, but I won't ask you to know them. They are identified in the picture here on the right, but we'll just skip those. Now, at the bottom of K7, there are muscles in the larynx. When you look at this model, the red represents muscles of the larynx. And we're not going to ask you to know the names of any of these muscles. On the next page, K8, on K8, it just shows again, a picture with the various muscles. This is a lateral or side view of the larynx. And again, I'm not testing you on any of these muscles. The one thing I would like you to know on K8 is I put in capital letters, underline the word laryngospasm. And a laryngospasm, a spasm is an involuntary contraction of a muscle. If these muscles of the larynx spasm or contract, so they tighten right around the larynx. Now remember, air has to flow through the larynx on its way to the trachea, on its way to the lungs. So if all these muscles around the larynx can spasm or contract, tighten, constrict, it's going to be really difficult to breathe. So you might say, well, what would make them spasm? One of the things that would make these muscles spasm is if a bit of food drops down into the larynx. The muscles spasm or contract to prevent that food from going down your trachea and ending up in your lungs. So if somebody were, the classic example that's given is somebody's eating fish, maybe at a restaurant, and they happen to inadvertently swallow a little fish bone, and the fish bone ends up going down into their larynx. So all of a sudden the muscles spasm to prevent the little bone from slipping down through the larynx and going into the lungs. They spasm and the person can't breathe. So this is when you're told to do the Heimlich maneuver. So let me borrow, why don't you come over here, Paul. So do you have a car? Yeah. Okay, you won't need it after this. No, that's all right. So all right. So in a Heimlich maneuver or abdominal thrust maneuver, as probably many of you know, you kind of form your hand into a fist and you bring it into the tummy and push up like that, and you can probably feel it's forcing the air up and out your lungs. Thanks, Paul. So so that's called an abdominal thrust maneuver or Heimlich, as it forces the air out of your lungs. Hopefully, it'll create enough force to blow that bit of that fish bone or that piece of food that's entered the larynx, force it out of the person's mouth, and then they can start to breathe again. So you probably have heard of that. There's something else that can also cause these muscles of the larynx and airways to contract, and that's an allergic reaction. if you know of somebody who's very allergic to bee stings, to peanuts, or something like that, so if they come in contact with something they're very hypersensitive or allergic to, that can also cause a lot of these muscles of the larynx and the airways to constrict, and then they can't breathe. Of course, the Heimlich maneuver isn't going to help in this case. There's nothing stuck in the larynx to blow out. So what they give people, does anybody know what they give to people with this allergic reaction where they can't breathe? They give them epinephrine or adrenaline. There's something called an EpiPen. And a lot of people will carry a little an injectable shot of epinephrine with them in case that happens. But the Heimlich maneuver isn't going to help in that case. What is laryngitis? Laryngitis is an inflammation of the larynx. And so if it's all inflamed, where the vocal cords are, the person has trouble speaking. We say they're hoarse. Notice how you spell the word horse. It has a letter A in it. If you leave that A out, you're basically saying the person's like that animal that you can ride and eats hay. So, you know, it is spelled differently. Now, a carcinoma of the larynx. So that's cancer of the larynx. We know that, unfortunately, cancer can occur in any tissue of the body, any organ of the body can become cancerous. And the most common cause of cancer of the larynx is heavy smoking, chewing tobacco, sometimes heavy drinking. And of course, we know currently when somebody has cancer of any organ of their body, they remove it to cancerous structure. So if they remove the larynx, that means they're removing where the vocal cords are. So then the person can't speak. So one of the things they might give them is an electronic voice box. So I don't know if you've ever heard somebody, but it sounds, I am Zorg, I'm from the planet Xenon. It sounds like they're from another planet because it's a very metallic, electronic sounding voice, you know, but better than not being able to speak at all.